Hello, my name is Jenna, and today I'm going to be demonstrating how to properly don and doff PPE. So the first thing that you are going to do is don your gown. So you are going to grab your gown and you are going to pull it onto your body, making sure, of course, the gown is clean. You're going to pull the gown all the way up, making sure that it covers both arms in full and also from your neck to your knees. So you are going to tie the gown now around your waist, just like this, and also around the neck. So you want to grab the strings and tie behind your neck. Now that the gown is fully on, we are going to don our mask. So we are going to grab a surgical mask and we are going to put it on. We are going to pinch the nose piece so it's nice and secure and pull so it's snug on the chin. Next, we're going to don our goggles. Our goggles are our protective eye equipment. So we're going to put the goggles on, making sure that they are snug on our face. Lastly, we are going to don our gloves. So we are going to grab our gloves and pull them all the way up onto our wrist, making sure to cover this white cuff on the gown, just like so. Again, making sure to pull the glove all the way up onto the wrist, covering the cuffs of the gown. Now we have completely and fully donned our PPE. Now we start the doffing process. So the first step in doffing our PPE is taking off our gloves. So we are going to safely pull off our gloves by taking one hand and pulling the glove off, just like this. Then we are going to put the glove that came off into the hand that has the glove still on. And then we take our finger and we pull off the other glove. And now they are both in one area, and now we can properly dispose of our glove into the proper waste bin. Next, we doff our goggles. So we take off our goggles. Next, we take off our gown. We doff our gown. So we are going to untie the gown, and we are going to pull the gown away from our body, and make sure to only touch the inside of the gown. So we're going to pull it away from our body, just like this. We are going to pull it inside out, and we are going to put it into a bundle and put it in the waist. Lastly, we are going to doff our mask, take off the mask, and toss it into the waist. Now we have completely and fully donned and doffed our PPE. Now I'm going to be explaining the 4 different situations in which there are various PPE requirements based on the level and condition of our patients. So the first is standard precaution. And that situation is when you use any of the PPE that I just showed based on the level of potential exposure. Next is airborne precaution situations. And in these situations, the patients typically have things like the chickenpox and measles, and they are in a negative air pressure room where their HEPA filtration is changed 6 to 12 times in 1 hour. And what is required is a N95 mask for caregivers and visitors. Not patients, but for caregivers and for visitors. And the patient must only leave the room when necessary. And again, an N95 mask is required for airborne precautions. Next, we have droplet precaution situations. And these are things like the influenza, pneumonia, meningitis. Patients are in their own private room, and a surgical mask is required for caregivers and for visitors, and hands must be washed before you go into a room and before you leave a patient room. Lastly, we have the contact precaution situation, and patients who are in this kind of situation typically have things like MRSA or herpes, and a full PPE is required upon coming into the room for caregivers and for visitors. So the full gown, the mask, the gloves and goggles, and again, you must completely wash your hands before coming into the room and leaving as well. So those are the 4 different types of situations in which all kinds of PPE are required based on the severity and the health condition and situation of the patient. That is all. Thanks for watching. Bye.